Hello, everybody. Thank you for joining us. And those of you who download this video later, thank you for downloading and joining us. I'm Kevin Briggs, the founder and lead of Texas Day Peru. And for the last 13 years, we've been leading surgical teams down to Peru to help the poor and having a good time doing it. And we've got a special treat today. We've got Dr. Cindy Motta with us, who's one of our volunteer surgeons. I couldn't tell you exactly how many years she's been down there and been a part of it, but I've known Cindy now for 19 years, and we first met when she delivered my daughter via emergency C-section. So she can never do any wrong in my eyes, and she always has a place in my heart. So Cindy, welcome.
Well, thank you, Kevin.
So I've prepared some questions. I hope they'll be interesting for the folks that want to know more about what we're doing down there and the folks that we're helping. So to kick it off, what inspired you to volunteer and begin doing this?
Well, I think, I was just relaying to you a story about a surgeon from LSU that worked in Africa doing a lot of fistula repair and prolapse repair for those folks. And I was at a conference and he mentioned all of this. And I thought that would be something that I would really, really be interested in. And then just fortuitously linking up with you and also Dr. Crum, who had been on the mission trip for us for Texas Day Peru, really, really got me interested in wanting to volunteer. And so my first trip, I believe, was either 2015 or 2016.
Yeah.
And last year was my 5th trip.
Oh, goodness.
And of course, we had a big break because of COVID. So we were very, very happy to be back that year because the last time we were there was 2018, 2019?
19, yeah.
Yeah, 19. And I don't think I went on the 2019 trip. So it had been since 2018 for me. And so I was very, very happy to get back to do some good works.
I tell you, it's been such a joy having you as part of the teams. And you're right. It was so good to get back down there. And, there's no shortage of patients that need our help. So it was glad to get down there and get down to see everybody. You talked a little bit about prolapse and pelvic floor and pelvic organ distensions, et cetera. Can you describe some of the other needs and how that impacts women in their daily lives down there?
So because these women have a lot of babies, they work hard, they're on their feet for a lot of their lives. They're at high altitude. They have a great deal of pelvic organ prolapse. And I think that's the majority of what we see. However, we see a plethora of all sorts of other things. Now, it's all gynecology. We're not doing any obstetrics there, but it's all gynecology. We have uterine fibroids, so we do hysterectomies or myomectomies. We help them with birth control. So sometimes we're doing sterilization procedures or helping them in the clinic with obtaining birth control pills and other methods of birth control. In addition, we're doing abnormal pap smears. And we were lucky that the clinic did have a colposcopy device for us to be able to look at those. And we were also fortunate on one of our trips that we had a volunteer back in the States who bought us a cryotherapy gun to be able to see and then treat those patients while they were right there in the clinic. And that was a really big thing for us to have. In addition, we talk to patients about abnormal bleeding. So we're doing procedures like a DNC to help kind of clean things out of the uterus if they're having abnormal bleeding and get tissue sampled to make sure it's nothing worse. We have patients that come in and see us who've been to other clinics, and they'll frequently bring in a CAT scan for us to look at if they have a pelvic mass or other abnormalities. So we really do get a broad range of gynecologic problems that we're seeing when we're seeing the clinic patients.
That cryotherapy gun, those were donated by Pink Ribbon, Red Ribbon Foundation. They do a really good work in fighting cervical cancer in Africa. And we're happy to be partnering with them down there in Peru. I'm wondering, can you share a particularly moving or memorable story in your experience down there?
Sure. I've got a very, very good one. So I had and this was actually, I think it was my first year down there. I had an older lady. She had complete pelvic organ prolapse. So essentially, her uterus was outside of her body. Exactly. And these are fairly complicated surgeries to do because we have to address all of the support systems. And so she was all set to have her surgery done. We had her all set up. And unfortunately, the day that she was supposed to come in to do her surgery, the buses were on strike. Do you remember this?
I remember
they
that.
do this, yeah, every once in a while. So because she didn't want to miss her surgery, she and her husband got up at 4 o'clock in the morning and walked from a neighboring village all the way over for us to be able to do her surgery.
Oh, wow. I forgot about that. Yeah.
Yeah. Yeah. And she was so, I was dumbfounded because this was not a young woman and a young man. They were like my kids called they said they were the Peruvian grandparents. And I said, that's exactly what they were. And so for them to have walked that distance to come and let us take care of them was really, really amazing, really moving. And she fortunately did very well after surgery, was so appreciative. And again, this is one of the things where we can really, really make a difference in someone's life.
You know, from what I read, women can't even sit down with this.
Right. That's right.
You know,
yeah, there's hygiene issues that are involved in this when the uterus is not where it's supposed to be. So it really does affect their day-to-day living to a great deal of extent. And so, being able to do these surgeries are amazing that you can really affect someone to that extent.
Yeah, it's huge. So what's the collaboration like? What's the local clinic staff is like? I mean, we can't do what we do without the clinic on the ground there. What are the staff like there?
So some of the nursing staff have been there for 20 years since the clinic has been opened. And that is great because they have such a good workflow and how things are done, and it makes our job much, much easier. A couple of the nurses generally do come with us to see the patients because I understand Spanish very well, but I don't speak it very well. So one of the MAs, or one of the nurses, not the MA, one of the nurses that is down there all the time, Mary, she has been with me every single time that I have been there. And on the flip side of things, she doesn't speak English that well, but she understands it very well. So between the two of us, we get along great, and we're able to see the patients without any problems. The other thing is that some of these patients are from really the mountainous areas, and they only speak Quechua, which is the Incan language. So sometimes we're translating from Quechua to Spanish to English and making sure nothing gets lost in the translation. But again, having a couple of the nurses there that do speak Quechua, very, very important. We've also had a lot of volunteers that our director and his wife know that come in and help us translate with the patients, and they're fabulous. They make our job so much easier.
It's interesting. There's a pretty sizable American expatriate community there. So let me get semi-emotional with you. How's this experience affecting you personally and professionally?
Medicine is very hard. Medicine, we work a lot of long hours. And sometimes for the most part, it's very, very rewarding. And we feel the gratitude of our patients. But some days are not like that. And being able to go down there, making a huge difference in someone's life. And I always say that it fills my tank back up. And it makes it easier for me to come back from the trip and really feel the appreciation of truly practicing medicine without all the burdens of the insurance and the bureaucracy and, this, that, and the other, because we don't deal with a lot of that when we're there, and we're there to talk to the patient, listen to what the patient is telling us, and then doing the appropriate things in order to help best take care of the patient. There are no insurance issues that we're dealing with there, and it makes such a huge, huge difference.
Get paid in hugs more often than not.
Exactly.
Yeah. So for folks who might be interested in volunteering with them and supporting what we're doing, you have any advice? And then the second part of that question, is there anything that you would like to share with the audience that we haven't covered as well?
So if you're interested in this, I encourage you, come to our website, contact Kevin. We can always use volunteers. You don't have to have any kind of medical knowledge to come and help us. We'll put you to work, and we'll give you things to do, because everybody plays a small part in making us successful. Some of the challenges are, of course, getting there with all our equipment. And, we've been able to, and we got a little behind with COVID, but we had a lot of medical companies and hospitals and people and organizations that really did donate equipment and materials and, their time to help us out with getting all of those logistic things together. And again, COVID made it a little bit harder. We lost some of our contacts through attrition. But if you're interested, please, we can always use the help.
Amen to that. And we'll find a way to help. And it's really interesting, people help in lots of different ways, both large and small, and it all makes a difference.
Absolutely.
So Cindy, thank you so much for spending time with me today and talking about this. This is one of my favorite topics in the world, obviously.
Well, Kevin, as I've told you many times, you've done a wonderful thing by getting this organization up and running over the past, 10 years, right? That we've been doing this. Has it been 10 years or more?
13
years, because I didn't come until 2016. And I just, one of the really fabulous things that's happening is that they're building us a new clinic.
Oh yeah.
It's going to be larger, and we're in a pretty tiny space right now, but I'm really excited to see the new clinic and to be able to see more patients. The more people that we have that can go, the more patients that we can see. The trip is about 2 weeks with travel and everything. We usually see about, I want to say 300 or more in the clinic over that week time.
Yep.
And then we've been doing it on average, I think about 30 surgeries. And if we had more space and more physician volunteers, if we've had 3 gynecologists the past few years that we've been, which has been great. I think the year that I went with Ted, it was just only he and I.
Mm-hmm.
So adding a 3rd gynecologist is really, really great. I think we could use a 4th. And that would just, again, have us, and, as long as we've got the surgical rooms, which how many surgical rooms are they going to have at the new clinic? I can't 3. Oh, great. Because we only have the 2. We always need, we also need ancillary staff like nurses to do recovery, to do post-operative care unit. Scrub techs. We could use MAs. We've brought medical assistants with us before to help us in the clinic. And also, if you don't have to necessarily have any experience with being in an OR suite, we'll gown you up and glove you and teach you how to retract and do everything. We've had some medical students and also some undergrad students who've come to volunteer with us, looking for some first-hand, just getting an idea of what we do. and that experience. I think it's a wonderful experience. I can't wait to get back.
Well, you raised a good point. One of the things we're trying to do is do more than one mission a year, have, week after week after week of missions. And a big reason to do that is so we can see more patients in those weeks. But a lot of times, we're taking a lighter load the last day of the mission because we don't want anybody staying overnight. We can't leave them there without us being there to take care of them. So having that overlap of mission to mission to mission, I think will probably increase our throughput by about 25%.
That would be great.
And I think
we have plenty of patients, and we don't want to turn them away.
Yeah, that's the sad part to me, is we see 300 people there, and we don't have the opportunity to do surgeries for all of them. We have to limit what we can do.
Right.
And you're right.
But amazing experience. And again, I see the future. I will be there as many years as I possibly can.
Well, I'm glad to have you. Well, thanks so much. And we'll cut off for now. And thanks everybody for watching us.
Okay. Thanks, everyone.
Bye-bye.
Bye.